management of chronic Lindane effects. This can be chronic as in chronic exposure, or just the long-lasting effects of one dose or multiple doses over a long period of time. Just to note that it's always hard to predict chronic effects. This is because everybody's DNA reacts differently. Your DNA comes from your parents, and it determines kind of how you react to drugs and what you may have allergic reaction to versus what somebody else may have an allergic reaction to. So we've already discussed that Lindane is very toxic to the nervous system. It accumulates in the brain in the white matter. This has physical and mental effects. There are multiple ways of treating all of the symptoms and side effects on this page. The best way with most of them would probably be a diazepam treatment, which if you refer back to the previous video and the diagrams, you'll see how diazepam works. It's a sedative, so it really calms any anxiety, depression, verbal tics, tremors and seizures. But the more intricate conditions, such as urinary and fecal incontinence, can be treated with things like defaricin, which is a more specific treatment for those problems. And then if intrusive thoughts can escalate into long-term mood disorders, you can go for something like a selective serotonin reuptake inhibitors. Everyone's different, so everybody will respond to these drugs. It's not a one pill fits all. You have to try multiple drugs to get the best biochemical balance for each individual. So then there's the hormone disruption aspect of this. So starting with males, it leads to a decrease in testosterone, sperm count and increased testicular size. Things like testicular size, we really can't pharmacologically intervene too early on, as we can't predict when cancer's going to come, otherwise we'd probably be millionaires. And so we recommend early regular screening for this, and the earlier you catch something like this, the easier it is to treat. And then for the other more complex hormone issues, testosterone replacement, lifestyle changes, gonadotropin hormones stimulating the production of sperm, really encouraging the alternative treatments such as lifestyle ones. Lifestyle changes would be very beneficial to a patient. And then you have the female effects, so Lindane can have long-term effects on estrogen and progesterone balances. These are hormones that regulate the menstrual cycle, so birth control can help these, lifestyle changes. Same with ovulation, there's lifestyle changes, and then there's a clomiphramate citrate. This drug induces ovulation, helps a woman get pregnant so that the egg is readily available to be fertilised. And then you have something more severe, such as your endometriosis. This is a reproductive condition where the uterus grows outside of the allocated area. Things like birth control and progesterone therapy can really help this, but it varies from person to person. Finally, the carcinogenic effects. This is something that could cause cancer. It's very detrimental to human health. Luckily, we don't really use it anymore. So early screening programs, as it's quite effective to the liver because that's where it's metabolised, and effective to the oral surfaces if used orally, even though it's not meant to. So guys, just a summary, chronic effects vary from person to person, and realistically it's really hard to predict what's going to happen later on down the line, so we've got to treat these as they come up. Something could happen in 10 years and it just has to be managed as and when. If you have any questions, feel free to see our references and go to the contact the team on the Meet the Team page. Thanks.